Namaste, good morning, and welcome to Times Health Plus. I am Dr. Sneha Rathi. I am a musculoskeletal physiotherapist and a certified yoga teacher from the Yoga Institute, Santa Cruz, Mumbai. I combine the techniques of physiotherapy and yoga and give the best results to my patients through them. Today, we are going to discuss about a very important and very commonly encountered condition and joints, which is very, very important to tackle in our daily life. And that is nothing but the cervical spine and the shoulders. So, how to take care of your cervical spine and your shoulders is what we are going to delve into a little bit more of depth. Okay, so today we are going to discuss things into three parts. First is the most common conditions associated with the cervical spine and shoulders. The second part is more about what are the localized stretches which can relieve the tension in your neck and the shoulder region. And the third part is going to be I'm going to get into some of the asanas which you may feel are not impacting your cervical spine or shoulders, but are actually making a lot of difference into their posture and their strength. Okay, so we may feel that certain generalized asanas are not impacting the cervical spine and shoulders, but I'm going to get into the secrets of those asanas which are actually going to work on your cervical spine and shoulder wonderfully. Okay, so let's get dive into it. Let's get ready to understand more about these joints which are really important in our everyday life, and it's a very common finding to see most of the people suffering from neck pain or shoulder pains. Okay, so now what are the most common conditions that we encounter with the cervical spine and the shoulders? The first and foremost and most common condition is posture. Okay, so very commonly found is a forward head posture. Okay, so what is a forward head posture is nothing but your neck is ideally aligned over your shoulders. Okay, but when it becomes forward head, it actually goes in front of your shoulders and the alignment changes, and which is why it is called as forward head. Okay, so that's why forward head posture. Okay, it is not very good for the cervical spine since it creates a lot of strain on the neck. It can lead to cervical headaches, okay, very commonly encountered. People encounter pain starting from the occiput, maybe radiating till the forehead even, okay. So that kind of headache, sometimes even vertigo, okay, and regular generalized neck pain that can happen, okay. So this is postural. Next common thing is rounded shoulders, okay. So along with forward head, rounded shoulders is very, very common because we tend to stoop towards gravity, okay. So that's why rounded shoulders becomes very, very common, okay. So we're going to discuss about how to tackle these conditions. The next thing that is very, very common is a rounded back as well, okay. So a thoracic kyphosis. So these three things generally go hand in hand. So once forward head starts, it also takes the shoulders into rounded posture and the thoracic spine also into a rounded curvature. That's how it happens, okay. The next common condition which is encountered in the cervical spine, which you all must have heard about, is cervical spondylosis, okay. It's a degenerative condition wherein the disc heights reduce, okay. There is greater pressure on the cervical spine and the joints of the cervical spine starts getting degenerated. There may be formation of bony spurs and it constantly creates a lot of pain in the neck region, okay. So very common, especially in people who are above the age of 40. So this condition is very, very common. Hence it becomes very important to take care of your neck and your shoulders on a regular basis. So make sure you are doing yoga asanas, you are doing exercises, so that this kind of cervical spondylosis does not get onset very easily, okay. So this is another condition which is commonly encountered. The third thing is muscle strain. So sometimes you may have experienced when you overwork, or if you are in an awkward posture while working, your muscle may develop a spasm or a cramp or a strain, okay. And then people generally come with the complaint of, I'm not able to turn my neck completely, okay, towards either side, something of that sort, okay. So muscle strains are really common in cervical spine, especially if you do not have a habit of exercising on a regular basis. It becomes even more common, okay, because you need to put your neck into various positions, okay, so that no position becomes very awkward for it, okay. So every time you put your neck into various positions, like we're going to see when we do yoga asanas, okay, then you are training it to handle any kind of position, you know. So that is very, very important to avoid muscle strains. Okay. So the next thing that is very, very common in cervical spine is disc herniations. You may have heard about people having slip disc in the neck, and that can lead to compression of nerve which is going to the arm and the forearm or the hand. Okay. In such conditions, what happens is they experience pain. Sometimes there is weakness. Sometimes it is also associated with tingling and numbness. In all of these cases, whenever you are suffering from a slip disc, you need to consult your orthopedician and also get associated with a physiotherapist and take a structured treatment for the same, because this can be really worsening if not taken care of on the initial stages. So it becomes very, very important that you tackle any such radiculopathy or anything that is leading to slip disc and compression of the nerves. Okay. And the next thing that is very, very important, that is very common, is in the neck region, is nothing but what you call it as a work posture related problem. So desk jobs, people with desk jobs, they tend to develop such neck conditions very commonly. Okay. The next thing that is very common in the shoulders is something that we all know. I think it's about frozen shoulder, wherein the movements get really restricted, okay, and the shoulders can get really painful. Okay. So this frozen shoulder comprises of various stages. Okay. So what happens with this frozen shoulder is, in which stage you are, your management is accordingly. I'm telling you all of this information so that you can actually handle, if there is any such condition, you can handle it in a better way. All right. So this is about frozen shoulder. Sometimes the movements in the shoulders, okay, they can become painful. Okay. That can be due to various reasons. It can be due to a muscle strain. It can be due to if there is any impingement, if there is an altered strategy in the shoulder, that can also lead to pain. In these cases, it needs to be diagnosed properly and it needs to be treated accordingly. So these are the various common conditions that we encounter in the cervical spine and the shoulders. Okay, now it is very important that you tackle these conditions before your onset itself. So make sure that you are regularly exercising and you are regularly performing asanas so that it strengthens the neck and the shoulders. Okay, so we are going to look into these asanas and the details of it very strategically as we go about ahead. All right, so before going to the next part of the session, I'm going to answer a few questions, maybe. Okay, so the first thing is Shailesh ji says, Suprabhat, Suprabhat Shailesh ji, can you suggest asanas for body stability? Started Tadasan, Veerbhadrasan, can't do Natrajasan without help of the chair. Also can't do Vrikshasan, will appreciate your feedback. So Shailesh ji, you can always start with the support of the chair. In any kind of stability asanas, it's very important to maintain your gaze stability. Okay, so if you are starting with any balancing asanas, make sure that your gaze is stable at one point and try to focus as much as possible to maintain your stance. Okay, initially you can take support of the chair or even the wall. Okay, slowly and steadily, as you start practicing, it takes some time to develop the stability. Slowly and steadily, you can gradually remove the assistance from the chair and the wall. But make sure your gaze stability is very, very important. All right, so make sure you are maintaining a proper gaze. Besides that, many strengthening exercises of the legs and core will help you with the same. So you can look into the other videos of mine wherein I have explained the strengthening of the legs and the core, which will help in improving the stability. Nidhi ji, good morning. Sarosh ji, good morning. Amitabh ji, good morning. All right. So can you share exercises for tendinitis in the shoulder? So I'm going to share a few movements probably, but if you have tendinitis, you need to first subside the inflammation in the tendon. So you would need some local therapy for the same. And then eventually you can go with a graded exercise program. So it needs thorough evaluation as to how much of the tendinitis is there. All right. So let's start with some local stretches in the neck and the shoulders, which is going to relieve the tension in the neck and the shoulders, and it is going to help you, maintain the mobility. All right. So these are some local stretches that I'm telling you, which you can practice. So the first stretch is you sit in the chair straight, okay, and slowly and steadily bend your neck forward and backward. So you're going to bend forward as much as possible and bend backward and straight. Now, mind you, it's very, very important that you do not sit in this position and do the same thing. Okay, this is not the right position because it's going to create a lot of strain on the neck. So it is very important. What is your starting position? Make sure you're sitting erect and then starting with the neck movements. All right. So slowly bend forward. These are some local movements. Okay. And backwards. As much as possible, complete the movement. Okay. Doing halfway is not going to be beneficial. You need to have a rhythmic, smooth movement of the neck. Okay. Down and up. So this is one. The next one is we're going to rotate the neck towards either sides. Okay, so turn your neck towards the right side as much as possible and towards the left side. Okay, I think you must all be knowing these common movements. Okay, but these are very important movements, especially if you're working on a desk job. Okay, you need to take breaks every hour, and maybe you can try and do 5 movements of these types, that will relieve the strain on your neck. Okay, so again, turn towards the right as much as possible and towards the left. Right and left. Right and left. Last time, right and left. Okay, so if in case your movement is restricted to a certain extent, you can gradually work on slightly, maybe 5% pushing into the range. Okay, gradually your movement will start increasing. Notice how much is your movement and rotation and try to work accordingly. All right, next is we are going to drop the ear to the shoulder. Okay, so what we are going to do is just drop the ear to the shoulder like that and bring it back straight towards the left and bring it back straight towards the right, straight, left, straight. You should feel a stretch on the opposite side, okay? That's what we are seeing when we do this exercise or Sahaj Bhavasan. Okay, this is also called as a Sahaj Bhavasan. Towards the right, straight, towards the left, straight, towards the right, straight, and towards the left, straight. Now, if you see in this particular movement, my gaze was maintained straight and I'm not trying to turn my neck or I'm not trying to, the neck is very much aligned with the body and it's exclusively ear to the shoulder, center, ear to the shoulder, center. All right. So this was about the neck movements. And next is shoulder shrugs. Okay. So what happens generally is this muscle, that is the upper trapezius, it gets strained quite often because it has to maintain your body along with the back and core muscles. It also tries to hold your body a little bit upright and it also supports the neck. So it is very common to experience stress in this particular area. Okay. So what you can do for that is you can do shoulder shrugs. It's going to help you activate the muscles as well as relax them. Okay. So what we're going to do is we're going to shrug the shoulder up towards the ear as much as possible and slowly relax it completely like that. Again, up towards the ear and relax it completely. Again, up towards the ears and relax it completely. Once again, up and relax it completely. Last time, up and relax it completely. All right, so this was shoulder shrugs. Now we are going to do shoulder rolls. Okay, so what we're going to do is keep our hands by the side and just roll the shoulder back to forth. Okay, again, take it back, roll it forward. Take it back, roll it forward. Back and forward. Back and forward. And we can do it other way around, forward to back. Again, forward to back. This way, 3, 4, and 5. Do the same thing on the other side. 1, 2, 3, 4, 5. Other way around. 1, 2, 3, 4, and 5. Okay, so these were shoulder rolls. Again, very relaxing for the shoulder. Okay, so this you can also perform. This is going to actually activate the shoulder blade as well as the shoulder muscles. Next, what we are going to do is we are going to interlock the hands and then stretch them upwards. So interlocking the hands, we are going to stretch them upwards. Okay, so your hands are facing towards you right now and stretch. Stay there. 1, 2, 3, 4, 5, and slowly take your hands down. Again, interlock your hands, stretch them upwards. Stay there. 1, 2, 3, 4, 5, and slowly relax. Okay, we will repeat it again. Interlock your hands and stretch them upwards. 1, 2, 3, 4, 5, and relax. Once again, interlock, stretch. 1, 2, 3, 4, 5, and relax. Okay. Now we're going to turn the hands outside and stretch upwards like this. Okay. So turn the hands and stretch upwards like this. Stay there. 1, 2, 3, 4, 5, and relax. Okay. Once again, turn the hands up and stretch. 1, 2, 3, 4, 5, and relax. Again, stretch upwards. 1, 2, 3, 4, 5, and relax. Very good. Again, stretch. 1, 2, 3, 4, 5, and relax. Last time, stretch. 1, 2, 3, 4, 5, and relax. Okay, now what we are going to do is we are going to stretch our hands in front. Okay, so what we are going to do again, interlock the hands and stretch them in front like that. 1, 2, 3, 4, 5, and slowly down and relax. Once again, stretch forward. 1, 2, 3, 4, 5. Relax. Again, stretch forward. 1, 2, 3, 4, 5. Relax. Stretch. 1, 2, 3, 4, 5. Relax. Okay, now same thing but with the arms turned out. So we're going to stretch it like this. 1, 2, 3, 4, 5. Relax. Again, stretch. 1, 2, 3, 4, 5. Relax. Stretch. 1, 2, 3, 4, 5. Relax. Stretch. 1, 2, 3, 4, 5. Relax. And one more time. Stretch. 1, 2, 3, 4, 5. Relax. All right. Now we are going to stretch some local muscles of the shoulder. So what we are going to do is interlock the hands, take it in front, and now take it across the body. Okay. So with the help of the left hand, I'm trying to stretch the right hand. Okay. And keeping my elbow straight of the right hand, I'm trying to stretch the shoulder. Stay there. 1, 2, 3, 4, 5. Bring it to the center and towards the other side. 1, 2, 3, 4, 5. Center. Towards the other side. 1, 2, 3, 4, 5. Center. Other side. 1, 2, 3, 4, 5. Center. And you can relax your arms. Okay, keeping the arms up may be a little strenuous for the shoulder, but you need to make sure that you slowly build the endurance of the shoulders so that they can support your neck enough. Okay, so that's why holding the arms up is also very, very important. Okay, so we're going to stretch this once again. So hold, interlock your hands and slowly stretch. 1, 2, 3, 4, 5. Center. Towards the other side. 1, 2, 3, 4, 5. Center. Once again, stretch. 1, 2, 3, 4, 5. Center. Other side. 1, 2, 3, 4, 5. Center and relax. Okay, you can roll your shoulders just to relax them a little bit. Okay, this was about the local stretches of the shoulder. There is one more stretch which I would show you in the standing position. Okay, so we are going to stand up. So what we are going to do is we are going to interlock the hands back slowly, stretch it downwards, try to open the chest and look up. Stay there. 1, 2, 3, 4, 5, and relax. Okay, mind you, a lot of movement is happening at the chest and the thoracic spine. Okay, it's not from the lower back a lot. Okay, it's more at the chest and the thoracic spine. That is very, very important in this case. Okay, we are going to do it again. Stretch. 1, 2, 3, 4, 5, and relax. Okay, one more time. Stretch. 1, 2, 3, 4, 5. Relax. Stretch. 1, 2, 3, 4, 5. Relax. Perfect. Okay, so this is all about the stretches of the shoulder and the neck, which is going to relieve the local tension, okay, that develops due to a constant positioning of the body. So if you are especially doing any desk work, this is going to be very beneficial for you. Okay, it is going to help you relieve the tension from the neck and the shoulders. But these are just stretches. We need some activations as well. So what we are going to do is, one is we are going to fix the fingertips of our hands with each other and slowly press them against each other, okay, and stay there. 1, 2, 3, 4, 5, and relax. Okay, we are going to do this again. Fingertips and stay there. 1, 2, 3, 4, 5, and relax. Once again, press the fingertips, stay there. 1, 2, 3, 4, 5, and relax. Okay, so this was a little bit of activation. It's going to activate the entire arms, okay, up till the neck. Next, we are going to do a namaste position, and we're going to take the shoulders towards one side as much as possible. Stay there. 1, 2, 3, 4, 5, and towards the left side. 1, 2, 3, 4, 5, and relax. All right, once again. 1, 2, 3, 4, 5. Center towards the other side. 1, 2, 3, 4, 5. And center and relax. All right, one more time. 1, 2, 3, 4, 5. Center and the other side. 1, 2, 3, 4, 5. Center and relax. Okay, next, a very important exercise or Sahaj Bhavasana for the shoulders, for especially those who have rounded shoulders, is doing Paschim Namaste. Okay, so Paschim Namaste is nothing but joining your hands at the back. Okay, so I'm going to turn backwards and join my hands at the back and stay there. 1, 2, 3, 4, 5, and relax. I know it is not very easy for everybody to do that. Okay, so it's very, very important to reach as much as possible. Even if it is here, it is fine. Okay, so try as much as possible to reach your shoulders behind. Okay, so just joining the hands behind and stay there. 1, 2, 3, 4, 5, and relax. Once again. 1, 2, 3, 4, 5, and relax. But this movement particularly should not be very painful to you or too much stretch on the front of the shoulders. Make sure you are doing it within your comfort zone. It's okay to start with a little movement initially and gradually progress over a period of time. Okay, not trying to achieve everything in one go. So, these were some of the stretches which are going to be really beneficial for your neck and shoulders. Okay, so before we go on to the asanas, okay, which asanas can be performed for the betterment or taking care of the neck and the shoulders, I would go through a certain questions. All right. So let's see. Renuka ji, I have back pain. It emerges whenever I do yoga or bend exercises. Suggest something which will help, and why is this happening? Renuka ji, there can be a core weakness. Okay. So the control of the back is not enough. That is why when you bend forward, okay, that control, if it is not there, it can lead to some kind of aches and pains. But you need to be thoroughly evaluated for this kind of pain, and only then it can be commented. But I would recommend that you start with certain core strengthening exercises and hip strengthening exercises. Maybe that can help you with betterment of the yoga practices that you are talking about. All right. So Suchita ji says, I have neck pain after playing badminton. How can I avoid it? So Suchita ji, make sure you're doing adequate warm up before the play and you're doing adequate cool down after the play. It's very, very important because when you are playing badminton, there is a lot of forceful and rapid movement happening at the joints. There is a high chance of injury in these cases. So it's very important that you start with a good warm up before you start playing, and you end with some light stretches of the neck and the shoulders after you are playing. Also, make sure you are practicing any form of exercise on a regular basis to strengthen the neck and the shoulders. It is very, very important. Okay, Arvind ji, I am 37 years. I have very stiff body, especially the hips. Can you help with hip opening exercises and stretches? Yes, Arvind ji, there is a session that is coming on hips, how to relieve the hip stiffness. So stay tuned to these Sunday sessions. I'm going to cover how to, relieve the hip stiffness eventually. Saroshji says, I have spondyloarthritis on lower spine hip joints. Get pain after waking up after exercising, including yoga. Any post-workout stretches I could use to ease this pain? Okay, so Saroshji, again, it is very important that you have a good core strength, because you are saying that after yoga or any kind of form of exercise, it leads to pain. So it is very important that your core strengthening and local stability exercises are done well. So something like Marjorie Asana and Bithilasana can help create that kind of mobility. So you can try practicing this slowly and smoothly, okay, and try to strengthen your core as well as hip. That can help you relieve with this pain. However, again, as I mentioned, all these things needs to be evaluated properly under a professional, and only then something can be suggested. These are just general suggestions that I'm giving based on what you have said. Okay. Shamaji, what are sciatica exercises? Please tell about them also. All right. So I have covered a little bit about sciatica in a different session other than this, but eventually probably we are going to come across some information on the sciatica as well. All right. So now let's start with some asanas which are going to be really beneficial for the neck and the shoulders. We have already warmed up the neck and the shoulders enough. Now just let's warm up the other joints as well and then start with the asana. So I'm going to ask you to lift your wrist up and down 5 times, 3, 4, and 5. Okay, now we're going to hold our hands, interlock, and rotate our body. 1, 2, 3, 4, and 5. Okay, now slowly lifting your hips up. 1, 2, 3, 4, 5. Next is bending your knee. So you can bend your knee, hold your ankle, and stretch a bit. 1, 2, 3, 4, 5. Now, rotating your ankle. So, just rotate your ankle. 1, 2, 3, 4, 5. Other way around. 1, 2, 3, 4, 5. Okay, now the other ankle. 1, 2, 3, 4, 5. Other way around. 1, 2, 3, 4, 5. All right. So now we are going to start with Tadasana 4. Okay. So what we are going to do is 1 foot distance between our feet. We're going to cross our hands in front. Okay. And slowly come up on our toes while raising the hands up. Okay. So inhaling. 1, 2, 3. Stretch up. Stay there. 1, 2, 3, 4, 5, 6. Exhaling. 1, 2, 3. Okay, we do it now the opposite hand. So my right hand was up earlier. Now I take my left hand up and do the same thing. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Okay, so you might think, how is it impacting the neck and the shoulders? As you take your hands up and you stretch your hands up and hold that position, it's going to relieve a lot of stress on your neck. Okay, because when the arms are up, a lot of the shoulder muscles are activated to support the neck. So it becomes very beneficial to help in strengthening the arms. As well as this is an elongation pose wherein you're stretching upwards. So you're actually trying to decompress the spine and create that elongation effect. All right, let's do it once again. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Okay, now the other hand up. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Okay, so this was Talasana 4. Okay, which is going to be very beneficial again for the shoulders and the neck. Now we are going to go to Konasana. Okay, so this is nothing but Konasana 2. You can see how it is going to be beneficial for the neck, because we are going to gradually move the neck, rotate it along with the body movement. Okay, so we are coordinating the movement between our thoracic spine and the cervical spine. So let's see how to do this. You have to take about a 2 feet distance to 2.5 foot distance between your feet. Take your hands in front of you. Now inhaling, take the hands at the shoulder level. Exhaling, bend forward and slowly touch the opposite toe with the hand and turn your neck towards the upper hand. Stay there. 1, 2, 3, 4, 5, 6. Slowly come back. 1, 2, 3. And take your hands down. 1, 2, 3. It's very important that you go as per your comfort and do not try to push your shoulder too much behind. Okay, do not try to overstretch it. Try to go as per your body synchrony. As much as you are with your body synchrony, it's going to be very beneficial. Let's see it on the other side. Take your hands at the shoulder level. Inhale. 1, 2, 3. Look at your left hand and slowly lower it down. 1, 2, 3. Now slowly turn and look towards the left hand. 1, 2, 3, 4, 5, 6. Come back. 1, 2, 3, and 1, 2, 3. Okay, so if you see how we are moving in a synchronized way, okay, slowly our neck is turning towards one side and then turning upwards. Okay, so now let's see this asana once again. Take your hands at the shoulder level. Inhale, 1, 2, 3. So you look towards the hand now, which is going to go down. So I'm going to look towards my left hand and now slowly turn my body down. Now turn my head up and look towards the right hand. Stay there. 1, 2, 3, 4, 5, 6. Inhaling, come back. 1, 2, 3. Now turn and look towards my right hand. Go down. Exhale. 1, 2, 3. Turn and look towards the other hand. 1, 2, 3, 4, 5, 6. Come back. 1, 2, 3. Exhale. 1, 2, 3. So you see how synchronized is the movement. Normally we are always in a sitting or standing position, so one particular neck position, but this movement is going to actually target the neck and take it into different positions against gravity. So it's going to be very beneficial. Next, we are going to create a little traction effect on the neck and the shoulders. So that is going to happen nothing but through Hasta Padasana. Okay, so what we are going to do is keep our legs together. Inhaling, take our hands up. Bend backwards. Exhaling, bend forward. And now over here, try to touch the ground and leave the head a little loose. Stay there. 1, 2, 3, 4, 5, 6. Inhaling, take your hands and ears together and come up. And relax. But if you are suffering from any high blood pressure, okay, you're not going to do any head low position. Plus, if you are suffering from any cervical slip disc or acute cervical spondylosis, please do not do this forward bend position. All right, so let's do it again. Legs together. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale, hands and ears together and come up. 1, 2, 3. Exhale. 1, 2, 3. So you again see how synchronized is the movement. Okay, I'm taking my hands and ears together first and then coming up. Okay, so that's kind of activation of the entire chain of the upper back and the neck. Okay, so let's do it one last time. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. All right, so this was something that created a little bit of traction because we are holding our head towards gravity. So it's going to create a little bit of traction on the cervical spine. It is very beneficial for the cervical spine. All right, so the next thing that we are going to see is a little some of the sitting asanas, okay, which are going to be beneficial for the neck and the shoulders. So let's sit on the mat. Okay, so now what we're going to do is, first one is Parvatasana. If you are able to sit in Padmasana, try to do that. If not, you can sit in Sukhasana as well, or this can even be done on a chair, okay, with the legs hanging down, that's fine. Okay, so what we're going to do is take our hands by the side, inhale and lift our hands up. 1, 2, 3. Join them together and hold. 1, 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Okay. So now over here, I'm not trying to interlock my thumb or something. It's a pure namaste position, which we are attaining in the final pose. All right, so we are going to do this again. Inhale, 1, 2, 3. Stay there, 2, 3, 4, 5, 6. Exhale, 1, 2, 3. A very effective and beneficial asana because it's going to stretch and activate all the muscles of your back, which are going to keep your posture a little more erect. So you can actually increase the amount of hold that we are doing. So you can slowly increase it to maybe 10 counts, 15 counts. So you can do it for about 30 seconds as well. Okay. So let's do it once again. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Okay, so this was a simple Parvatasana but a very effective pose. All right, now we're going to do Gomukhasana. Okay, that stretches a lot of muscles and it is very helpful, especially if you have rounded shoulders. So here, what we are going to do is we are going to slowly legs straight. Take our left leg beside the right hip. Take our right leg beside the left hip. And now, whichever leg is on top, that arm goes on top and interlock it behind and stay there. 1, 2, 3, 4, 5, 6. And slowly relax and release. It's okay if you're not able to interlock behind, you can probably hold a handkerchief, okay, and try to reach gradually as much as possible. Okay, another important thing is do not create a forward head posture while you are doing this. I have noticed many people doing this just to reach the arms behind. Do not try to do that. Try to keep your back and posture straight and then try to join your hands behind. Okay, this becomes really very important. Now let me show you from behind how I'm interlocking my hands. So we are going to go towards the other side. So right leg beside the left hip, left leg on top, and slowly take the hands behind and interlock. Stay there. 1, 2, 3, 4, 5, 6. And slowly relax and release. Okay, change the legs again. Interlock and stay there. 1, 2, 3, 4, 5, 6. And slowly relax and release. If you are not able to reach, it's okay to be here. Try to hold a towel or a handkerchief and then try to slowly come closer to your hands. Okay, so that's how you can do the Gomukhasana. Okay, so now let's see the other part, other asana, which is very beneficial and which you may not have thought about. It can help your neck and the shoulders. Okay, so that is nothing but Ashwa Sanchalan asana. Okay, so now what I'm going to tell you is normally we keep our hands down all the time. Okay, very rarely we raise our hands up. Okay, but with this hand down posture, what happens is it also pulls the neck into forward head and rounded shoulders. Okay, so we need to train our neck to remain upright even if the hands are down. Ashwasanchalanasana is a great asana to do that. Okay, so now what we are going to do is we're going to go on a quadruped position. We're going to keep one leg forward. Okay, now keeping our hands down, we're going to keep our back a little bit erect. So look straight and slowly stretch forward. So here my hands are down, but my neck is absolutely straight and trying to push a little up. Stay there. 1, 2, 3, 4, 5, 6. And slowly relax and release. So even though my hands are down, I'm trying to elevate my cervical spine. Okay, a very good aspect of training the cervical spine and the shoulders. Let's see on the other side. Yep. Slowly, hands down, but neck up and stay there. 1, 2, 3, 4, 5, 6. And relax and release. Okay, again. 1, 2, 3, 4, 5, 6. Relax and release. The other side. 1, 2, 3, 4, 5, 6. Relax and release. Okay, so this was Ashwa Sanchalan Asana. Now we are going to go for Adho Mukha Svanasana, which is a little bit of weight bearing on the shoulders. It's going to strengthen your shoulders as well as strengthen your neck to take the weight. But make sure you go gradual and easy with it. Okay, so here what we're going to do is we're going to go into quadruped and slowly stretch our feet down and push our body towards the thigh and stay there. 1, 2, 3, 4, 5, 6, and slowly relax and release. Okay, so gradual weight bearing of the shoulders. It's a natural weight bearing, so it's going to strengthen your shoulders. We will repeat it again. Hands on the mat and slowly. 1, 2, 3, 4, 5, 6, and back. This is also very good for posture correction, okay, because it's going to stretch your legs and it's also going to create a straighter spine when you do it correctly. Okay, so we are going to do it once again. Stretch. 1, 2, 3, 4, 5, 6, and slowly relax and release. Okay, so this is one of the asanas which can be again beneficial for your neck and shoulders. The next thing that we do is balasana. Okay, so we are going to just stretch our spine and we are going to stretch our neck as well. What we are going to do is we are going to sit in Vajrasana and slowly slide our hands forward and relax. 1, 2, 3, 4, 5, 6. Slide your hands and come back to the neutral. Okay, once again, inhale and exhaling. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Come back. Inhaling. 1, 2, 3. A very relaxing pose. It's going to ease out any tension in your neck and shoulders. Again, inhale and exhaling. 1, 2, 3. Stay there. 2, 3, 4, 5, 6, and come back. 1, 2, 3. All right, so this was about Balasana. Next, we are going to see a Sahaj Bhavasana, which is in lying down position. So you can turn on your side and lie down on your back. What we are going to do is keep your legs straight, take your shoulders to 90 degrees, bend your elbows to 90 degrees. Now slowly, we are going to turn the arms outside as much as possible and then bring them back to neutral and turn them inside as much as possible. Okay, so again, take them outside and turn them inside as much as possible. So this rotation movement is very, very important for the shoulder. Usually this is what is affected first whenever there is frozen shoulder. Okay, 3, 4, and 5. Okay, next what we are going to do is Yashtakasana. So keep your legs straight, slowly inhaling, stretch your hands up and point your toes down. Try to reach till the ground. Stay there. 1, 2, 3, 4, 5, 6. Exhaling. 1, 2, 3. Again, inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. One more time. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. So this was about Yashtikasana. Now we're going to see a local shoulder movement. Again, a Sahaj Bhavasana. So you turn towards one side and slowly raise up your hand from the side. Stay there. 1, 2, 3, 4, 5, 6. Lift up and back. Again, inhale, raise up your shoulder. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. One last time. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. A simple shoulder asana, but it's going to be very beneficial in the long run. Now we're going to go on the abdomen and we're going to perform Bhujangasana. But make sure now you pay attention to the instructions that I'm giving over here. Okay, so keep your forehead on the ground. Keep your hands beside your chest. Heels together till the end of the asana. Now slowly inhaling. With 20% weight on your hands and 80% is from the back, you start lifting up and stay there. 1, 2, 3, 4, 5, 6 and down. 1, 2, 3. So while performing Bhujangasana, I have seen many people initiating the entire Bhujangasana more from the neck, and which is why it becomes a little more painful at the end. So it is very important that you try to sequentially raise your spine at every level and try to make the movement very easy and very smooth and rhythmic. Okay, do not completely start extending your neck and then doing Bhujangasana. Okay, so we are going to do it again. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. One last time. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Okay. Now you can turn on one side and get up. And we are going to do one breathing exercise, which is also going to be beneficial for the shoulders. It's called the clavicular breathing. So what we are going to do is keep our hands and fingertips around the shoulder. Fingers are facing forward and this thumb is back. We're going to try to inflate this area while we are breathing in and out. Okay, so what we're going to do is inhale, exhale. Focus on this particular area while you are breathing. Again, inhale, exhale, inhale, exhale. Now we are going to do equal breathing. So inhale, 1, 2, 3. Exhale, 1, 2, 3. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Last time. Inhale. 1, 2, 3. Exhale. 1, 2, 3. And relax and release. Okay, so this is clavicular breathing. It will also help you relax the shoulders and the neck. All right. So these are some of the asanas which can benefit. There are many more asanas which can really help with the neck and the shoulders, but some of the asanas which I could tell you and a little bit on the details of it, how it is going to help the neck and the shoulders. All right. So let's see what are some other questions. So Chandrasekhar ji, please tell how to overcome back pain in spine tip or lumbar region. Chandrasekhar ji, you can refer to one of the, I have taken 2 of the lower back sessions. You can see those videos. You might get some more information on how can this be done. Uh, okay, can this asana be done with low back pain? Manpreet ji, I guess you're talking about Gomukh asana. In that case, if there is a lot of low back pain, maybe you can just do the Gomukh asana arms without crossing the legs. Okay, because crossing the legs can create some strain on the lower back. Okay, so you can just do the arms. Chandrasekhar ji, my left shoulder seems bent too much compared to the right shoulder. What asanas can help to overcome this? So, Yastikasana is a very good asana to, stretching the shoulder out. Even Gomukhasana, for that matter, is a very good asana to stretching the shoulders. These 2 asanas can be really beneficial to stretch the shoulder out. Okay, Arunji, I have shoulder pain. What should I do? Arunji, this needs a little more detailing on what kind of shoulder pain you have or when does it occur exactly. Okay, I need to understand a little more details of it in order to be able to help you out with it. All right, so this was all about today. I'm going to give you a challenge for today, that is practicing Gomukhasana arms every day. So what you need to do is you need to practice Gomukhasana arms every day, okay, and feel what is the change in the flexibility and relieving of tension in the shoulder. You can click a picture of it and upload it on Instagram and tag Times Health Plus. Also, do follow Times Health Plus on their YouTube and Instagram channels. So, I hope I have added on to your knowledge on how you can improve the cervical spine and shoulder health even more. All right, so this was it for today. See you next time with some more details on other joints. Till then, stay present, move gently, and make sure you take care of yourself. Thank you and namaste.